Okay, let's talk about our patient today.
Our patient today is a dentist.
Young lady, a preeminent lecturer,
The dental hygienist,
from Bulgaria,
Buffalo, New York.
Atlanta, Oklahoma, Vancouver, Canada, Boston, Kansas City, San Francisco, Montreal, Munich, Germany, London, and Santa Maria, California. And we're going to place 14 Lumineers,
8 Lumineers.
10 Lumineers,
6 Lumineers.
10, 2, 8, 8, 10, 10, 8, 10, 8 Lumineers today on our patient.
And now we're not treating teeth anymore. We're treating smiles.
Isn't that beautiful? So let's look at the transformation from where we started and where we are. Our patient today is an example of that. I'd like to say good afternoon to everyone in Atlanta, and we're going to show you the placement of Lumineers on a patient who doesn't want to have her teeth ground down, but she would like to improve their appearance. So today we're going to place 8 Lumineers. One of the things that's very important is that you have a sapphire light and 4-power magnification. When you're working on a patient without anesthetic, you want to be able to see so you can avoid those sensitive areas. You don't want to give the patient anesthetic because if you're grinding on a sensitive area, you won't know it until the anesthetic wears off. Gordon Christensen says he wouldn't work without the sapphire light. Does anybody in the audience have a sapphire light? Well, according to Gordon Christensen, working without a sapphire light is like working with a slow-speed handpiece versus a high-speed. When I place these, I will bond 8 veneers in less than 60 seconds. Another very important thing is getting a good impression. Suggest before you send your cases in that you pour your models, you check your margins, and make sure that they're very definitive because we need a clear-cut definition of that gingival margin. Then if you take the impression out too soon, you may get some distortion. So we suggest that you leave the impression in an extra 30 seconds, and the technique we recommend is the Invisalign double wash technique for getting the sharpest impression. Jessica has already adjusted the Lumineers, and she's placed the porcelain conditioner, and she's placed the Serenade Prime on there, so they're bonded. She's polished the teeth with porcelain polishing paste with an enzyme in it. We use that to get rid of the plaque, so when we go in with the acid etch, we don't have the plaque on the teeth prevent the acid from coming in contact with. So it's super clean. I like that better than working with pumice that just pushes the plaque around. And I'm putting paint on dental dam on here. And the reason I'm putting this on is because wherever I put on the paint on dental dam, it's the same one we use for bleaching to protect the gingival tissue. And wherever I place this, it'll prevent the ultrabond and the tenure from coming in contact and facilitates cleanup. Best way to protect your eyes is to close them. Close your eyes. Close your eyes. And when you have diastemies, you got to be careful that it doesn't run from the lingual side, close your eyes, to the labial side, and then you won't be able to seat your Lumineers. And we'll put a little on this bicuspid right here. Open. Close your eyes. So wherever the paint on dental dam has been placed, it'll prevent the ultrabond and the tenure from adhering to that surface. Then we're going to take and apply Etch and Seal. Etch and Seal is 35% phosphoric acid containing aluminum oxalate. And the purpose of the aluminum oxalate is when you're working on patients with your regular operative procedures, you open those dental tubules, then what will happen is you can get sensitivity. But if you have the aluminum oxalate in there, it plugs up the dental tubules and helps prevent sensitivity. So it's a very handy little thing to use. I'm using medium viscosity here so I can control the placement of the etching material. We etch for about 20 seconds. Now you'll notice the patient has no problems with the gingiva. You want to have a patient that's got a healthy dentition. And then we'll put on Tenure AB. Tenure AB was developed by Dr. Ray Bowen. He came to me one time when the ADA meeting was being held in, same city you're in today, Atlanta, and said, Bob, you know, I've got this dentin bonding system that just is fantastic, but he said, it's got 9 steps and nobody wants it. So we took out a license with the ADA and worked with Dr. Bowen and got it down to 2 bottles, 1 step, and nothing has been produced that's any better than Tenure AB. And one of the advantages to Tenure AB is it's light independent. The nice thing about Lumineers is their studies, as I said, go up to 20 years, and they are repeatable. Now I'm putting on a material called Tenure S. Now if we were putting the veneer on and doing the try-in for shade, we wouldn't want the Tenure S on the teeth because a Tenure S, when you use it to clean out the unset Ultrabond try-in paste, which is the same formula as Ultrabond, it will cause it to set. And one time I was doing some try-ins on my secretary, and I had the Tenure S applied and not knowing it. And when I went to take her Lumineers off, they wouldn't come off. Now the good news to that story is that was the right shade. Okay, right central. Jessica always calls out the name of the tooth. As I said, we already pre-selected the shade so that in the interest of time, right lateral. Okay. Right cuspid. First bye. Hold it now, no more yet. This LumiGrip is a very handy little device developed by a dentist by the name of Omer Meeker. The brush. Putting the 2mm tip on for 1 second. Close your eyes. And that's to position it in place. Close your eyes. Close your eyes. Now that'll fix those in place so they don't go floating all over. Left lateral. Okay. Left cuspid. Okay. There we go. Yeah, I get that seated. You want to see excess Ultrabond all over. Wipe off some of the excess. Take the 2mm tip for 1 second. Close your eyes. 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 Okay, now we'll take the brush and wipe off the margins all around the edge. And some of the tenure S is already getting the Ultrabond to polymerize, even before the light's gotten to it. So it's a nice backup system. Now I'm going to go and apply a 5-second application to each tooth. We have 8 teeth, and that's 40 seconds. Close your eyes. 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 Now we'll show you what it looks like on the lingual side. And we'll wipe off anything that's on the lingual side that isn't set. And this is already beginning to be set, even though it didn't get any light. Now we'll take the Shure 349 instrument. But you see, if you're prepared ahead of time, this goes along very rapidly and very simply. So before you do your first case, you and your staff should watch a couple of the DVDs of cases we've done, because this is a very simple procedure. If you got everything ready. You don't want to be going down the runway and just remember that you didn't check the fuel cap or check the flaps. And now all we have to do is finish it. And we're going to scrape off some of this excess. And I use the Shure 349 because no matter how hard I scrape, I will never scratch the porcelain. So you never want to use a hygienist scaling instrument to do this. Oh, one thing I should tell you, I'm taking the ultrafine football-shaped diamond. All these things are in the clinician's finishing kit. And I'm going over the occlusal surface and blending the Ultrabond in the porcelain and the enamel all together. So it's one homogeneous mass. Now we're going to take the 12-fluted burr. I like to use that first because it'll remove the Ultrabond and it won't remove very much, if any, porcelain, and I stay on the interproximal areas. Remember, I'm working with 4-power magnification. That's very, very important. Now, one of the things that's very important that I'm doing right now is removing the excess Ultrabond. So now we're going to take the long, narrow diamond. So we take this, and I'm only 3 inches from the surface of the tooth with 4-power. But functionally, I'm about 15 inches from the tooth. So I am able to feel as though I'm walking between the teeth. And that's what Lumineers are for anybody that wants to look better and doesn't want to have their teeth cut down. Now, what I'm doing, okay, just a second. What I'm doing right now is blending the gingival margins and looking at these interproximal embrasures and make sure that they're open. Oh, on that, finishing that porcelain to porcelain, I always wait 24 hours to get the maximum bond strength as opposed to just treating them like a enamel surface. Okay, now we're going to take a look at the occlusion here. Grind around? Open. Well, let's take a look at the occlusion right here, because if I've got some prematurities, porcelain on porcelain here, she's going to break it. Did you see that? All the occlusion was on the natural tooth structure. So they say, what if? And I tell people, choose the cases where you got the right foundation and do those first. And then if you want to go out and stretch things out and explore the limits, go ahead. And what I'm going to do right here on this cuspid, because the shoulder is about a 45-degree angle, so I just take my 30 fluted burr and I create the emergence profile that I want. Okay, here we go. This is called a seri saw. Watch this. I just slide through the contact. How you like that? Why did that work so easily? Because I spent maybe 15, 20 minutes getting all the ultrabond out from the contact. Because if you get in there and you feel resistance, then you stop sawing. I'm using a fair amount of pressure here. These are all opening today. They don't always all open. I try to get patients out of the chair in about an hour, because it's a short period of time. And you get a dramatic change in their appearance. So they're so excited. Okay. Now I've got these contacts open, but I'm taking what we call a seri sander. And we'll just sand these interproximals. And the ones that I don't do today, I do on the follow-up visit. Now, follow-up visits are really fun because patients come in and they're telling me how their family is so pleased with the change in their appearance. Big smile. And I get the one she had before. That's how she was, and here's how she is. Would you like to take a look? Everybody's got to look at this but you. Okay, here you are.
Oh my god.
Huh?
Oh my god.
You like it?
Right.
Huh?
It looks really good.
Is that good?
Yeah.
Huh? All your life you wanted this and your dentist couldn't do it for you, right? Because you didn't want your teeth ground down. Okay.
I chose to get Lumineers because I wanted to improve my smile. I had spaces on both sides of my teeth, and I had looked into putting braces back on, which I didn't want to do. I felt I was too old for that. I didn't want to look like an adult that, with the braces. I also looked into getting implants, but I was very concerned about the pain. So I thought Lumineers would be the best option for me. I would not have gotten my teeth ground down for the same result that I have now. My new smile has made me really excited. I was already pretty bubbly and outgoing before, but people have noticed the last couple of days. They're like, "Oh, you're just glowy. You're effervescent." And I said, "Well, I'm just showing it off." But I've gotten a lot of compliments just from my coworkers. And people who didn't know that I was getting it done had already said, "Well, you had such a pretty smile before, but wow, we didn't really see it." So it's, of course, it's really boosted my confidence, but I think it's just, it generates excitement. It's generating a lot of excitement with people who aren't familiar with what the Lumineers can actually do. So now I'm just really thankful. I'm really appreciative that I was chosen to be a model and to be webcast for people to see what it can do for even the small, non-major cases.